let's go deeper and let's discuss this question. Most of the time I've diagnosed patients with gallbladder stones. They have asked me if the stones can turn out to be cancerous, and the answer is yes. I present to you a case of a 7-year-old woman who came to our facility complaining of right flank pain, and the patient had jaundice and severe abdominal pain. When the doctor saw the patient, they thought it was good for us to do an abdominal scan just to see if there's any problem in the abdomen. And actually what we found out, our conclusion was cholelithiasis. The patient had multiple gallbladder stones embedded on the posterior wall of the gallbladder. So actually we thought the patient had to undergo an emergency surgery. They did a cholecystectomy, removal of the gallbladder, and the gallbladder tissue was subjected to histology, to biopsy, where they found out that actually the patient had gallbladder cancer of grade 3, what we call adenocarcinoma. So from that, we realized that once we see gallbladder stones on ultrasound, try to look at them. How do they appear? Are the stones mobile? Are they embedded on the wall? Are they multiple? Some of these things will make us to come to a conclusion, or will form our thoughts, our second thought, that maybe what we're dealing with is a gallbladder cancer. So actually, when we see these features, those doing the scans kindly advise the patient and the doctors accordingly, so that at least if you suspect that there's anything malignant, kindly advise the patient, advise the doctor who send the patient for the scan. So at least if surgery can be done, at least let us go ahead, do it, and let us do biopsy to see exactly what we're dealing with. Because I know most of the time we have told the patient to go and repeat the scan maybe within 6 months or 1 year to see if the stones have gotten out. But if you can look at them and then you think that they look suspicious, kindly let us go ahead and help the patient. Because if we find out that it's cancerous, I believe that medical intervention can be applied so that at least we can save a life. Thank you always for following me. Thank you always for liking my video, and I'm always looking forward to speak to you next in my next video. Thank you, and have a great day ahead.